So doing laparoscopic surgery will involve specialized training to be able to deal with minuscule instrument in a different terrain or different environment from the open surgery. Because pediatric laparoscopic surgery is so precise and so minuscule, you need the additional specialized skills and ability before you are able to do independent laparoscopic surgery for children. So to be a laparoscopic surgeon, one needs to be training to do pediatric surgery with somebody who is experienced doing laparoscopic surgery. Often in this field of surgery, it's an apprentice type of training, whereby you learn from the trainer or master over the years to do laparoscopic surgery. I often go to certain centers around Malaysia to train people to do laparoscopic surgery in their center so that they train to do laparoscopic surgery within their center and have the hands-on experience within their field so that the other people, the nursing staff, the anesthesia staff, anesthetic staff also learn how to engage with the surgeon doing the laparoscopic surgery.